Okay, so diastasis recti, that is the separation of the linea alba, which is the connective tissue between the right and left sides of the rectus abdominal muscles, and those are like your six-pack abs. Okay, so a true diastasis is anything that measures greater than 2 centimeters, and it is typically measured with finger width. So the width of your fingertip, which will vary slightly from person to person based off of the size of their fingers. So things that we're looking for when we go to test it is the density, which is as you push in, how far can you push in and what does that tissue feel like? So is it softer where you can push in a little bit deeper, or is it a little bit harder and denser where it's more difficult to push into that separation there? So again, we're feeling along the midline, so just below the xiphoid process at the bottom of your rib cage here, feeling along that midline just below the belly button. So we'll lay on our backs to start, okay? And we'll start again at that xiphoid process. We're going to just kind of feel that tissue at rest and just to kind of give you a baseline there. And then you're going to do a little sit-up. So feeling along the midline, down to below the belly button. Okay, and again, seeing how many fingers you can fit in width-wise, and then also, what does that tissue feel like? How dense is it? How much can you push in? And you may notice that one area is a little bit wider or less or more dense than other areas along the midline. Okay, so again, feeling down just below the belly button there, and just kind of making a mental note of how wide and dense it is there. Okay? And that's how we check for diastasis.